Thank you again to the people of Hawaii, especially those of you on the front line, our doctors, nurses, healthcare workers, and first responders. I would also like to thank all the essential workers who are helping our state remain operational by continuing to provide core services and programs for our residents. I want to thank Lieutenant Governor Josh Green, who is joining us for our briefing today. As I stated yesterday, the Lieutenant Governor is the healthcare liaison for the state of Hawaii. He plays a vital role in this crisis. Today, the Lieutenant Governor will provide an update on his activities. He will be followed by Dr. Bruce Anderson, who will provide the latest update on confirmed cases and testing in Hawaii. Today is the first day of my mandatory 14-day quarantine for everyone who arrives in our state, both residents and visitors. Since announcing the quarantine, along with my request for travelers to postpone their vacations for the next 30 days, we have seen a dramatic decrease in arrivals. As of Tuesday, March 24th, arrivals by air were down 87% compared to the same time last year. They have dropped from 30,000 per day to a little more than 4,000. My directives are working. And Tim Sakahara from the State Department of Transportation will provide more details on how the quarantine is being implemented at our airports and what it means for residents and visitors. The important fact is that we must try to stop visitors from coming to Hawaii in order to stop the spread of COVID-19 in our community. For those of you watching at home, especially those in the visitor industry, and supporting businesses who have been directly impacted by this crisis, we know these are challenging and uncertain times. Please know that I'm working closely with our county mayors and my department directors on additional policies to support our businesses and workers who have been economically hurt as a result of COVID-19. Also, on the economic front, there is some good news from our nation's capital. Yesterday, the Senate passed a $2 trillion economic stimulus package that will get money to Hawaii residents and businesses and help our economy weather this storm. The measure goes before the House for a final vote tomorrow, and we are working closely with our congressional delegation to determine the exact details of how the stimulus package will help Hawaii. We will share these details with you in the coming days. Today, I'm also announcing a new initiative being implemented by the U.S. Army Corps of Engineers. They have completed a site assessment of the 204,000 square foot exhibition hall at the Hawaii Convention Center, and they are providing initial planning and assessments for the possible conversion of the convention center into an alternate care facility. Their assignment from FEMA is intended to provide support during possible medical facility shortages. And with us today is Lieutenant Colonel Catherine Sanborn, Commander, U.S. Army Corps of Engineers, Honolulu District, who will provide an update on their project. Protecting the health and safety of Hawaii's people is my overriding priority. Getting through this crisis is going to take everyone working together. These are challenging times, and things will get worse before they get better. But Hawaii is strong. We have faced difficult times before and have always come together in crisis. We continue to remain strong and support each other. Together, we will persevere. Mahalo.
Our next speaker is Lieutenant Governor Josh Green.
Aloha, everyone. First, let me say thank you, Governor. Thank you for including me and welcoming me. I so appreciate it. I also want to say to the people of Hawaii, we do owe our governor a sense of thanks for today because this is the first day, as he mentioned, of the home quarantine. That was a bold move by he and General Hara, and it is going to save lives. Absolutely going to save lives. The last 2 weeks, I've spent my time speaking with our healthcare community, going to all of our facilities that I can reach. I visited Wilcox Hospital on Kauai, where they have an exceptional setup and are very well prepared to take care of any cases that may come. Maui Memorial followed, Hilo Medical Center, Kona Hospital, Queens Medical Center. Everyone is putting into place an important process, so if we do get a surge, when we do get a surge of COVID-19 cases that require intensive care, they will be ready to save lives of our kupuna or anyone who is sick. Each island faces different challenges due to limited resources, healthcare provider shortages, which we're all aware of, and I'm incredibly impressed by everyone's effort from Department of Health, the practitioners themselves, hospitalists, all to mobilize and prepare for COVID-19. We pray that it will not happen, but we are prepared that it may or will happen, and we have to save lives. My healthcare priorities: weekly calls to make sure all of our healthcare system is together, partnership with the Healthcare Association of Hawaii to speak directly with our providers and all of their needs. Right now, our biggest concern, or I should say among our biggest concerns, is having enough ventilators to make sure people can breathe if they get the severe disease of COVID-19, and enough PPE, that's personal protective equipment, so that no one gets sick as we take care of people. If you're a healthcare provider, a doctor, a nurse, or a PA, we're establishing a central location for you to share your concerns, updates, and procedures with us through a Facebook page, the Hawaii Health Corps group, that will provide extra volunteers, and we're in full partnership so everyone has the same information. We created a COVID-19 task force that meets twice a week to share best practices and recommendations. We scoured the country for supplies. We've gone to the rest of the United States. We know that we need PPE and ventilators, as does everyone, and I'm going to get into those numbers very briefly in a moment. The Healthcare Association, in coordination with General Hara, are continuously assessing our orders and needs. That goes every day, so though we know everyone would like to have more supplies, we will make sure we get all that we can. Currently, our supplies are sourced from HIEMA, or the Hawaii Health Emergency Management Inventory, which is from our federal stockpile and our national stockpile. We get resources from all over. Much of each inventory has been distributed to healthcare providers already, but we do continue to receive orders. Our next one, I'm told, will be 3:30, so just a few days. We need it constantly because we're very worried about people. As of March 26th, we had 18,000 N95 masks because we've been putting them out into the hospitals, 3,800 face shields, 20,000 pairs of gloves, and 22,000 surgical masks remaining. We're working to streamline this process. This is the first time we've had a global pandemic. We have to be ready. People ask me, and I'll go through these numbers very quickly, how many hospital beds we have. Are we ready? The state of Hawaii has 3,031 licensed hospital beds. The average daily census is 1,970. That means about 67%, 65 to 67% of our beds are filled. We can surge that capacity by about 15%, another 500 beds. That means we have 1,500 beds available if people get sick. We have 328 intensive care unit beds. We have 204 negative pressure isolation room beds if we have to isolate people. And we have 431 to 560 ventilators if we need them, depending on what's in supply and activated. We can also activate field hospital capacity if it's ultimately needed at General Hara's order. These numbers will fluctuate. They change from hour to hour. But what we want people to know is we are preparing to surge if we have more sick people than we normally could care for. We had 78 ventilators in use yesterday out of 431 ventilators that were activated, so we had more than enough if our loved ones needed them. We had 31 admissions for COVID screening yesterday, and we've had 7 admissions with positive COVID-19 tests in our hospitals. As of March 26th, and Director of Health will go over these numbers, I believe the number was 106. Our priority is to continue to give you information, to make sure we have additional beds if necessary, as the governor just mentioned, to make sure our provider capacity is improved and we can surge if we need it. In closing, this is a critical period. The governor is taking very decisive action, and we should applaud him for that. He's made Hawaii safer. Our mayors are implementing stringent policies to prevent a catastrophic peak of COVID-19 because we cannot have a surge like this and then down like this where we would not have enough capacity to care for people. When you hear flattening the curve, we want to go more slowly so we can care for everyone. We all need to listen to the governor, listen to General Hara. Please stay safe at home, home quarantine, follow those rules, and we'll get through this together. Thank you again. We are on the same page. I so appreciate you, Governor.
Thank you, Lieutenant Governor. Our next speaker is Bruce Anderson, Director of the Department of Health.
Aloha. Since I reported 6 cases yesterday, we've had a total of 11 cases of COVID-19 reported over the last 24 hours. Those include 2 cases from the Grand Princess. These are residents who were on the vessel and which is currently under quarantine, and they are being isolated there. Of the cases on Oahu, we have 8 cases on Oahu, 0 on the Big Island, 1 on Maui, and none on Kauai. All of these individuals are residents of the state of Hawaii. 3 of the cases we've seen have no history of travel exposure today. They're still being investigated. We've only heard about these over the last 24 hours. But it's the first sign that we've seen for a while that there is some localized community transmission occurring. They haven't been exposed to any of the areas that we know the virus is circulating, nor have they been in contact with any confirmed case that we know of. We expected this to happen. As we have seen the situation evolve, we've had travelers mostly coming to the state. In fact, over 80% of the cases we've had have been travelers or someone with exposure to an individual who's traveled. But we're beginning to see a few people who have no travel history, indicating there is some community transmission. We have not seen any widespread community transmission as of now. That is possibly going to change in the near future, but I'm very pleased that the measures that the governor has implemented and we're all following are seemingly having some effect. I wanted to also mention that we have almost 5,000 lab tests now completed. In fact, 4,934 in total. Most of those are being done by the private labs in the state. Our state laboratory is focusing on confirmation testing and in surveillance. None of the individuals who we've tested in our surveillance program have shown to be positive, which again reinforces the fact that we're not seeing widespread community transmission. But this is the time that social distancing is going to make a difference. This is where you should take isolation or your distancing very, very seriously and adhere to the guidelines that are being put out. Don't go to restaurants. Don't go to places that are obviously closed, and adhere to all the guidelines as it relates to social distancing. Thank you.
Thank you, Dr. Anderson. Our next speaker is Tim Sakahara, Public Information Officer, Department of Transportation.
Hello, everyone. Thank you, Governor, Lieutenant Governor, and mahalo to everyone out in the community as well. Today is the first day of the 14-day self-quarantine order for arriving passengers into Hawaii. Now, for some perspective, this has never been done in the state of Hawaii, and it's also never been done by any state in the country, having a mandatory 14-day quarantine period for anybody who's arriving into the state. So with that being said, the process is actually going very well. First, I'd like to talk a little bit about the process itself. The passengers on domestic and international flights will fill out their agriculture declaration form. Now, normally, they would hand that to the flight crew prior to boarding. But now, in this case, they're going to keep that with them. They're going to deplane or get off the plane, and then they're going to be met by a representative. That representative is going to take their form and then confirm it with their ID to make sure it matches up so that the name and address match up. Then they will be given some information to take with them. It's the order for self-quarantine on one side, and then information on the other side on what to do should they become symptomatic in the next 14 days while they are in their self-quarantine period. Now, residents will complete their quarantine at their home, and visitors will be quarantined at their hotel or their place of lodging. Now, the forms themselves that they gave to the representative will then immediately after the flight ends and all passengers have been processed, will be taken to a room inside the airport. They'll be scanned and processed and then sent to the Hawaii Convention Center. From there, representatives with the Hawaii Tourism Authority will then process, call the hotel where the visitors are staying to give them a heads up and notice that they do have quarantined passengers that are going to be on their way to that hotel. Now from there, random phone calls can be made to the hotel to ensure that that person is in fact in that hotel room and to verify that they are in fact quarantining. All right, so now I would like to talk a little bit about the passengers. I actually just came from the Daniel K. Inouye International Airport, and I could say that the passenger counts for today have dropped drastically. There are multiple flights that are arriving today with 0 or 1 passenger on board, and many of them are coming in with fewer than 10 people on the entire flight. The majority of those people are returning residents as well, who are coming back from another destination. For a little bit more perspective, too, comparing this March with last March, the numbers are also very drastic. As Governor mentioned, 87% drop-off overall from this March from last March. But just a little more perspective. On Tuesday, the last full day of statistics that we have for incoming passengers, for Honolulu, from domestic, the mainland in Canada, 2,430 total people came into Honolulu on Tuesday. Now compare that with last year on the same day, there was more than 13,500. Another quick example, on Kauai, that day last year, there were more than 2,500 people that came onto the flight. But on Tuesday, 38 total people flew into Kauai, to Lihue Airport. So you could see that the measures that have been put in place have been working. People are not coming into the airport, and visitors are canceling their trips or staying home. And now that the order is in effect, we actually anticipate that those numbers will continue to drop off, even more so. And so with that, we would just like to thank everyone who's doing their part. It is an extraordinarily uncertain times for a lot of the people in the transportation sector. So we certainly acknowledge and thank the airlines, the concessionaires, the hotels, certainly the Hawaii Tourism Authority, which is also doing a very big part in playing into this process, as well as the media as well, because that has been a big part, because the word has definitely gotten out to the people around the world that during this uncertain time, people should not be coming to Hawaii for their vacations. So with that, we thank the media, and we certainly thank the members of the public for doing their part to help prevent the spread of this disease in the community. Thank you very much.
Thank you, Tim. Our next speaker, our final speaker, is Lieutenant Colonel Catherine Sanborn, Commander, U.S. Army Corps of Engineers, Honolulu District.
Thank you, Governor Ige. Right now, the U.S. Army Corps of Engineers is leaning forward to support the people of Hawaii in potentially expanding healthcare capabilities amid coronavirus. This mission is personal to us. These are our families, local communities, schools, churches, hospitals, and more that are being impacted. We're committed to working with our partners to see this mission through to completion. We're moving forward with a FEMA mission to look at buildings in Hawaii that could be quickly converted to alternate care facilities. Should a request come from the state through FEMA to convert these facilities, we'll be ready to go. The design concept for these sites are flexible and adaptable, and if implemented, we're confident that they would help to expand medical capabilities in the state successfully. To support this effort, the Corps formed a planning and assessment team on Monday, March 23rd, comprised of 10 Corps employees, all volunteers for this important mission. We're completing these assessments in coordination with the state, the counties, Hawaii Emergency Management Agency, and local stakeholders. So far, our team completed 2 site assessments chosen by the state, including the Hawaii Convention Center on Monday, March 23rd, and the Neil Bladesdell Center on Wednesday, March 26th. The team is scheduled to conduct assessments on Maui tomorrow, March 27th, at the sites chosen by the state. Should the state request, and FEMA Direct, the conversion of existing facilities for medical purposes, we stand ready to support. As the nation's engineers, the Corps has the willingness, capability, and experience in construction to deliver this mission. While we're working this mission here in Hawaii, nationwide, and even internationally, the Corps is committed to coordinating together in a whole-of-government approach in the battle against COVID-19. In closing, I want to emphasize that we're taking this pandemic seriously. We are proud to collaborate alongside our partners in the delivery of resources that could save the lives of patients and healthcare workers alike. These are trying times, but we are all in this together. Our priority continues to be safeguarding the lives of the people of Hawaii, the nation, and its allies. Thank you.
Thank you so much, Lieutenant Colonel. Now it's time for our question and answer period. The first question is for Tim Sakahara. If you could make your way up to the podium. This is from Manolo Morales at KHON2. How many arrivals total, and how do you confirm the info on the form, the hotels, Manolo, I'm trying to get there. How many arrivals total, and how do you confirm the info on the form, the hotel, where they're staying? That's what he's saying.
Well, as far as the start of the day today, there were actually only 59 total scheduled flights to arrive in Hawaii, statewide. But many of those actually, or some of those were canceled and didn't even make the flight because there was no one on. So there's been a drastic reduction in not only passengers, but incoming flights as well. And even those flights that are coming in with 0 or 1 passenger, it is really because they still need to have the plane here in order to fly people out, the next day or later in the day. So that's the reason why some passengers, some flights are still coming in even with nobody on board. And in terms of verifying the information on the form, they do have to provide a real ID, an ID with them, so either a state ID or a driver's license, so that the representative at the airport that meets them at the gate will match up the two together and determine, okay, well, what they put on the form does in fact actually match up with their ID. If there isn't any sort of discrepancy, then they will question that and have the person either put the correct information that matches up with their ID. So that they can be able to track this person and see where they are.
Okay, Tim, you might want to stay up there. Next question also for Governor. This is from Audrey at the Associated Press. I spoke to some travelers who arrived at the Honolulu airport this morning. One woman thought she could still go out to buy toilet paper during the quarantine. Another said the 2 quarantine workers who met her flight from Seattle herded passengers off the gateway and didn't have them maintain 6 feet apart social distancing. She said the workers handed passengers a flyer about the quarantine but gave no explanation. My question, what kind of quarantine education are you providing passengers arriving at airports, and are quarantine workers expected to follow social distancing when they meet the planes?
Certainly, this is a brand new procedure, and the workers are implementing the quarantine process for the first time, and I know that we'll get better each and every day. This is a learning experience for everyone. The information that we're provided informs them of what the obligation is during quarantine, that they are not allowed to leave their rooms, whether it's in the hotel or at home, for any reason, and that if they violate the quarantine, that they are subject to a fine of up to $5,000 or 1 year in prison, or both. So all of that information is provided. We will inform the quarantine team at the airport that they should provide some information and instructions to the arriving visitors.
Okay, Tim and Governor, please stay there. This is from Chelsea Davis, Hawaii News Now. Are passengers requiring quarantine still allowed to take taxis, public transportation, or rideshare to their designated quarantine locations?
Yes, they are responsible for the cost of the quarantine, so they're responsible for the hotel costs. They are responsible for transportation from the airport to the quarantine site. The procedure will have people calling to verify that they actually made it to the quarantine site. Again, they are informed that a violation of the quarantine would be subject to a $5,000, up to a $5,000 fine and/or 1 year in prison.
Tim, do you have anything to add to that?
No, and that is true. Yeah, everything the governor said is accurate. And yes, it is up to the passenger to provide their own either transportation to their place of lodging or to their home.
Okay. Thank you very much. Our next question, Governor. Is the governor going to do any Facebook Live updates? Oh, I'm sorry, this is wrong. Okay. This is from Kristen Concilio, Star Advertiser. This is for Bruce Anderson, Department of Health. Can you tell us where the localized transmission is?
Kristen, thanks for the question. Obviously, people are interested in that. In fact, I honestly don't know the answer to that. We're still investigating those cases, and we'll look into that. Again, the cases that we've looked at today are here on Oahu, where most of the cases have occurred, on Maui and not on Hawaii or Kauai. So by elimination, you can determine it's probably on Oahu or on Maui. But I'll look into that. I must also add that these are the first cases recently that we've had where we haven't been able to find a source of the infection. They haven't had a travel history or a contact. There are a number of unknown cases that we've had even before this where we haven't found any clear evidence of travel or exposure to a traveler, but that's not to say it hasn't been happening before this. I don't think this should be alarming or surprising to individuals that we're seeing some localized transmission between people that we haven't been able to clearly identify. Obviously, as you go through your day, you run into people that may have been traveling, may not have been traveling, and you may not even know it. So I wouldn't put as much stock in that as I would in keeping your social distancing. Assume that you have COVID-19, that everyone else does. That's probably the safe way to approach life here, and certainly that would be a prudent way to handle the social distancing issue. Thank you.
Bruce, you might want to stay there. This is from Eleni Gill at Civil Beat. Why is it that the DOH is not publishing the private and state test count totals online anymore?
I believe we have revamped our website, and it is on the website somewhere. Let me, I'll run through the quick information that I have available to me now. The total number of tests performed to date is 5,034. Our state laboratory division has completed 387 of those tests. Many of those were part of the surveillance program we have. We now have 4 other laboratories that are doing testing. We have CLH that's done the vast majority of the tests. I'm sorry, they've done 3,632, DLS 1,011. Quest actually has contracted for separate testing for 4 of those individuals. And Clinical Laboratory has, on my sheet here, done, I'm sorry, those clinical laboratories together have done 4,647. I hope that helps.
Okay,
we'll get that on our website going forward. Thank you.
Thank you, Bruce. Our next question is for Lieutenant Governor. Lieutenant Governor, how many ventilators are on the island of Maui, if you know? And are ventilators among the federal and national stockpiles you mentioned?
Thank you very much. In my larger binder, I've got all the numbers of ventilators by island. The majority of the ventilators are on Oahu, and then a smaller percentage on Maui, Big Island, and Kauai has a very small number. I can get you that exact number. The purpose of having ventilators, of course, is if someone goes into serious respiratory failure, we can take care of them, and we do have 561 statewide. We can also make some more ventilators available. I just was getting a signal about the actual number. Let me give you that. 24 ventilators, yes, at Maui Memorial. We can surge some of our ventilator capacity by changing out the surgical rooms where we did elective surgeries before we came to this point. And so those surgical rooms can now have ventilators and some additional capacity because we get critical care people there as well.
Okay, Lieutenant Governor, you might want to stay there for our next question. We also might want to add Lieutenant Colonel Sanborn. Please, this comes from Ashley Mizuo of HPR. Where will the staff, medical, and maintenance for these sites come from?
So, great question from the Corps of Engineers. Our job is to provide the facility support, and we will collaborate with our partners for what is being called the wraparound services, including FEMA and Health and Human Services.
They also would like to know how many people would be needed.
Yeah, so thank you. The truth is we have a lot of people that have been on the bench for a very long time in our healthcare community, and we're reaching out to them now. We have 4,000 doctors in practice statewide, and we have 9,000 physicians that are actually licensed in our state. We've done some things just in the past day to make it more accessible to get those care providers. Also, we look to our schools that are pumping out providers, new medical students. There's a lot of people that we can bring to bear. And of course, General Hara's team and the military can bring a lot of staff as well. Although sometimes when we take military staff, we're taking it away from our civilian hospitals. So we're mindful of that. We do believe we'll have the capacity to surge if we have to fill those 1,000 beds if we have a very big problem. But we'll reach out nationwide if there are any other places that aren't offering care right now.
Okay, you might want to stay there. Lieutenant Colonel, we also have this question for you. What hotel, this is from Colleen Duechi from Maui News. The question is, what hotels are being considered on Maui for alternate care sites, and how would they operate?
Thank you for the question. So in terms of what sites we look at for assessment, that is provided to us by the state. So the state works in conjunction with the counties and FEMA, and then they provide us with a list of the sites for our team to go and assess. Secondly, I think the question was with respect to how does it work. So it depends on the type of site that we are trying to set up. There are a couple different options. And if it is for non-acute care or non-COVID patients, then it's pretty simple. We make sure it's sanitary and has all the necessary functions of a healthcare site. And then if it is a site for COVID patients, what we have the design to do is to look to create a negative pressure situation in the room, and then the rest of the equipment and staffing are provided by our partners. Thank you.
Okay, thank you very much. Our next question is from Max Dybel, Big Island Now. Is the state going to receive specific updates on the Kona-based drive-through testing that occurred at the old airport on Monday? And if that's already happened, what are the precise numbers of those tested?
Thank you, Max. The number they tested was approximately 200. The state will get immediate results. The protocol for the private sector testing is to be in full cooperation and collaboration with the Department of Health, because the Department of Health then has to make large decisions about resources thereafter. There will likely be some private testing that continues to go on, but it's meant to go on very carefully so that we always have enough reserve of tests for critically ill patients and also for our providers that are in the front lines, mostly first responders, medics, paramedics, physicians, nurses, so that they can stay well while we take care of the 1.3 million people here in Hawaii. We will have some additional testing information, and we will try to always put it on the website for people.
LG, please stay there. This is also from Max. I'm just going to give you his second question. Will ventilators or PPEs be shipped from Oahu to neighbor islands if needs arise, and can Oahu spare them, considering the vast majority of necessary supplies that are needed on that island?
We're all in this together. We consider ourselves one state. I think it's safe to say that the reason for getting assessments in each of the different counties and in real time, in coordination with the Healthcare Association of Hawaii, who is the overarching body that looks at all of our hospitals and facilities, they can tell us day to day where we might be having a surge of COVID, where we have a shortage of open ventilators. We know every single morning where our most great needs are. So yes, if we had to get ventilators to protect one part of our Ohana, we would get them there. We'd also try to bring in extra ventilators as we order them.
Thank you, Lieutenant Governor. Tim Sakahara, next question. Chelsea Davis, H&N. How many people were required to go into quarantine so far today, if you know?
I do not have an exact number yet, but as stated earlier, the passenger levels are very low as far as the volumes on the planes themselves. So I don't have an exact count for the day yet, but again, the majority of the flights, or many of the flights, are coming in with fewer than 10 people on board. I could say, actually, before this, the flight with the most people today had 54 people on it. But 25 of those actually were just layover. They're transiting to another stop, so they weren't actually even ever leaving the airport. And so that was, at that point, a couple hours ago, was the one with the most people on board. So you can tell that there are not a lot of people coming in. And, you know, just back to the AP's original question, too, on that social distancing question. I mean, you're coming in with 10 people or so on board, or a few dozen. Never in the history of aviation to Hawaii has social distancing been practiced more on an airplane. So the passengers are social distancing, are seated social distancing on the plane themselves. Very few people are coming off. So we would ask passengers to practice that themselves, right? I mean, if they're coming off, you don't need, while you're going down the jet bridge, to be standing within 6 feet, especially when there's so few people on the plane itself for the deplaning process. That being said, though, I was just texting with our airport managers, and we can send out a message to the flight crews and to the airlines to make sure that they can announce that as well before getting off the plane, so that the passengers know, are reminded to social distance as they're getting off the plane and as they're approaching the representative who's going to be taking and verifying their information.
Okay, Tim, stay right there. This is from Eleni Gill, Civil Beat. Can you clarify the rules of quarantine for air passengers versus residents in home quarantine? Do they differ? For example, are trips to the grocery store exempt for residents, but not visitors in hotel quarantine?
So both of them, both visitors or residents, are required to do the 14-day self-quarantine, whether at their home or at their hotel or place of lodging. And those people that are coming in on the arrivals do have the same rules. They are not allowed to go to restaurants or to go out in the public. The only exception would be is if there is a medical emergency, or if they are seeking a medical appointment, and those types of informations. I don't know if General Hara might want to speak to more of that, or the governor. Thanks, Governor.
The quarantine guidelines are the same for both residents as well as visitors. They are not allowed to leave the quarantine site. Food must be brought to them, so they have to make arrangements whether they're in home quarantine or whether they're in the hotel.
Okay, thank you very much, Governor. Lieutenant Governor, this is from Ashley Mizuo, HPR. Of those 5,000 non-practicing physicians, how many are over the age of 65, with so many Hawaii's doctors being elderly? Many of them will be at high risk of catching COVID, as well as should we be calling on retired physicians and healthcare workers?
Great question. About 2/3 of them, I would imagine, are over 65. And we would have lots of different capacity for individuals. For one thing, we're expanding telehealth, which will be very helpful to support our healthcare system, which then would free up a lot of the individuals that are otherwise in the clinics to go and provide some of that care. So we'd be very prudent about that. Dr. Anderson made that good point to me a couple weeks ago, that we should be careful about that. It's going to be a balance, of course. We only bring people off the bench when we have great need, but we do welcome support from all of our healthcare community.
Okay, thank you, Lieutenant Governor. Governor, what enforcement teeth does the quarantine order have? This is from Kristen Concilio, Star Advertiser.
The implementation of the quarantine order is by the counties working in support of the police departments in every single county. I was informed that a person violating the quarantine on Hawaii Island was detained and a citation written. So that is one of the reasons why it took some time to align the quarantine, mandated quarantine. It's easy to announce it, it's difficult to execute. And with the cooperation of all of the counties, we do have a quarantine system where we can identify those who are outside of the quarantine, and certainly we will be taking action as necessary.
Okay, Governor, you might want to stay up there. Tim Sakahara, you might want to join Governor. How are you monitoring private plane passengers arriving in Hawaii? This is also from the Star Advocate.
The mandatory 14-day quarantine order applies to all travelers coming into the state. There are companies that support private airplanes. They have been informed of the mandatory quarantine for all arrivals. They will be distributing the materials to those who are traveling on private airplanes, and they will be made aware that they are subject to the same quarantine that all travelers coming into the state is subject to. I don't know if you have anything else.
Is that good?
Exactly.
Yeah.
Okay. Actually, there was one more here. What tools do hotels have to ensure guests are abiding by the quarantine rules? And what are you doing to ensure compliance at vacation rentals?
Certainly we are working with the Hotel Lodging Association to try to inform everyone about what the requirements of the hotel quarantines would be. The industry has been supportive and been very helpful in assisting. We've distributed information about what is required in quarantine. They are implementing it in their facilities as guests come into them. So again, this is a whole industry effort. We do appreciate the support of the airline industry as well as the visitor industry. We are providing information and guidance to all of them so that they can help us implement quarantine. We know that this may be the new future of the visitor industry. We have to understand that in this era of infectious diseases, we need to be able to identify when people enter the state, be able to keep track of them and manage that situation going forward.
Thank you so much, Governor. Dr. Anderson, the next question is for you from Rick Kwan, KITV4. If someone tests positive, how far back do you go to see what contacts he or she may have exposed to the virus?
We assume the incubation period is 14 days. So when someone is symptomatic, we would be concerned about anyone who is exposed to that individual during that period of time and for the next 14 days. Those are the contacts, the close contacts that we would be most concerned about. In our investigations, we typically would quarantine any close contacts, and of course their activities would be restricted whether or not they develop symptoms. And of course, if they do develop symptoms, they're advised to go see a physician who very likely would order a test, given that they have been in contact with someone who is a confirmed case. I hope that answers the question.
Okay,
Thank you.
You might want to stay there. I'm just going to have Eleni Gill ask her question because you're there. Of the 106 cases to date, how many have been minors and how many older than 60, if you know?
I do know that. Out of the 106 cases we have, 104 are adults, that is individuals over 18 years of age. Only 2 individuals under 18 have been identified so far, which is not inconsistent with what they're finding nationally. Most of the illness, and we're looking mostly at serious illness, has been associated with adults, and particularly older adults, seniors.
Okay. Thank you very much, Dr. Anderson. Our next question is for Tim. This is from Manolo Morales at KHON. Alaska Air passengers said people aren't allowed off the plane if they are not residents. Is that policy?
No. Visitors are still allowed, but they would have to abide by the 14-day quarantine period. So yeah, I mean, residents and visitors alike are still allowed. They just have to abide by the quarantine period.
Thank you very much, Tim. Lieutenant Colonel Sanborn, this is also from Manolo. At what point will these alternative sites start getting converted if things get worse? How long will it take, and how much money will it take to convert?
First, to move from the assessment to actual construction of the sites, we'll have to get the mission from FEMA and then direction from the state. Secondly, in terms of how long, it depends on the site, and it depends on how we intend to use the site. So whether it's non-acute patients or whether it's COVID patients, so it depends on the use of it. And then third, in terms of cost, it also depends with, again, how the site is to be used, as well as the size of the site. Thank you.
Thank you very much. Bruce, you might want to answer this one. This is also from Eleni. Why are COVID test results taking up to 2 weeks?
Private laboratories are now sending many of their samples to the mainland. They're being slammed on the mainland with the requirements for testing across the country. Normally those tests would take only 3 to 5 days, which includes the time it takes to get the sample there. The 2 private laboratories in town that are doing those tests now are planning to start up local testing, which should speed up the process considerably. In fact, I think they're looking at a 24-hour turnaround for the tests going forward. Our state laboratories division can process a sample within hours. It takes some time to get to the lab, but we can pretty much count on same-day testing if we can get the samples before about 11 o'clock in the morning. So I expect the mainland laboratories are going to take longer and have been delayed in getting results out because they've simply had so many tests being required of them. We're looking at thousands of tests, not hundreds, thousands, and possibly in some cases tens of thousands of tests being required of some of the major labs.
Okay, Bruce, you might want to state it. This is from Ashley Mizu, HPR. When will we get more information about demographics of those infected, how severe their symptoms are, what parts of the island they live in, age and gender breakdowns, how long infection is lasting, things like that?
We're beginning to break down the data now in terms of getting a lot of the factors, risk factors, clearly identified. We've had surprisingly few cases. 106 sounds like a lot, but in other places where they're able to clearly break down the cases by age, sex, county of residence, and everything else, they're looking at a lot more. We have actually started to develop some epidemic curves, so which I would show you here, display the cases that are travel associated, cases that are not travel associated, and as I mentioned earlier, some of the cases that have no evidence of exposure to travelers. Over time, we're going to start seeing some trends here, probably similar to what we've seen in other places. Hopefully this curve is going to be a lot flatter than we've seen in some places where it has skyrocketed once they start community spread. But we are working on that, and we will be getting much more information out in the near future on all the risk factors here. Thank you.
Okay, Bruce, Ashley has a follow-up. Are any of those waiting on those tests currently hospitalized?
I believe only one case is currently hospitalized. We've had at least 7 cases who have been hospitalized for at least a short period of time. Remember, people are being admitted and then discharged, and so that number changes from day to day depending on the status of the patient. We have at least one case who's been in the hospital for quite a while, and typically cases would be in the hospital for a number of days. That's the experience in other places at least.
Kristen Concilio has a question for you, Bruce. How many people have recovered?
Well, virtually everyone's recovered so far. At least we haven't had any deaths here in Hawaii. I mentioned that the one death that we thought was attributed to COVID-19 was not, as it turns out, to be exposed or infected with COVID-19. So we have a 100% recovery rate as far as we know at this point in time. That's not to say we aren't going to see some deaths. Often you have a situation where someone is very fragile, and whether they have the flu or COVID-19, it just takes a little to tip them over the edge. I would expect we're going to see some in the not too distant future, simply because the group at risk is generally elderly and very often have other underlying health conditions.
Okay, thank you, Dr. Anderson. Governor Ige has FEMA. This is from Rick Kwan at KITV4. Has FEMA been contacted for help with emergency mortuary assistance?
I don't believe that FEMA has been requested for emergency mortuary assistance. I'm not aware of any specific need in that area.
Okay. Thank you, Governor Tim. Where are passengers getting screened on the neighbor islands?
So the neighbor island airports are following the same process. The representative will meet them at the gate as they get off the plane.
Okay, very good. Oh, one more from Dr. Anderson. Sorry, you have to come back up. This is also from Ashley. Reporters, if you can hear me, send in your questions. We're going to wrap up very soon. Dr. Anderson, how many of those waiting to get their test results back for COVID-19 are hospitalized? That was her question.
I couldn't answer that question accurately. If the state laboratory has done the test, again, we have a turnaround time of less than a day. So I doubt if any of those individuals who are seriously ill would be included in this. Generally, if a physician is requiring a test of someone who's severely ill and COVID-19 is expected, our state laboratory would do the test for someone in that high-risk group. But the private labs are doing testing for physicians regularly, and it could very well be that some of those individuals are in the hospital. Thank you.
Thank you very much, Dr. Anderson. Governor Ige, if you would like to make some closing remarks.
Just wanted to really thank the people of Hawaii for their commitment. The stay-at-home, work-at-home policy is so important. The next 2 weeks is very critical in this fight against COVID-19. It really is about flattening the curve to assure that our healthcare facilities do not get overrun so that we can ensure that each and every one in our community can receive the care that they need. All of us have been committed, and I'm really proud to see the compliance with everyone doing their part. It really is about social distancing. It's about allowing all of us to be respectful of each other. As Dr. Anderson had said, the best advice is to treat yourself as being COVID positive and ensuring that you keep distance from your loved ones so that you don't infect them. If all of us can do that in the next 2 weeks, we will definitely bend the curve to ensure that we can handle COVID-19 coming into this community. I really want to thank everyone for your commitment and dedication to our community. I am proud that we here in the islands always come together in a crisis to help each other, and I do know that working together, we will beat COVID-19. Mahalo.